Hey everyone, welcome to the Blue Mug Chat. It's good to be back after a short break of last week. And it looks like we are back in the middle of the pandemic. And this time, COVID has hit us with a vengeance because we have actually crossed the magic number of 1 lakh just a few days back. But we did have a breather. And I think we all had our guards down. And understandably so, because psychologically, I think everybody was so tired to feel that little bit of normalcy in life that as soon as the numbers hit 10,000 and below, we did take liberties, a little bit of liberties in our life. But it seems like we have to get back to being responsible. We need to bring that self-discipline back because the cases are on a rise. So we need to be responsible, not just for ourselves, but we also need to be responsible for the community and this country. But the good news is that as we speak, the vaccination drive is also full on. And hopefully in the next couple of months, we should see the decline in the number of cases. Also, from the time the vaccination has started to be administered in India, and we all know there are two vaccines which are administered currently, Covaxin and Covishield, there has been a lot of questions, concerns, issues, some myths surrounding the two vaccines. So today I'm very privileged to have Dr. Ashutosh Shukla with us, who is the head of internal medicine at Artemis. So he is the right person to actually address all your concerns, all your issues. And let me welcome him to the show. I already have a bunch of questions that I received from a lot of you. So I've compiled them together, but in spite of that, if you still have questions, please leave them on the comment section and I'm going to get to them at the end of the show. So let me bring in Dr. Ashutosh as we have a lot to talk about. We'll try and cover as much as possible in this show because I know there are a lot of you out there who are looking forward to hearing from him. So let's welcome him. Hello, Dr. Ashutosh.
Hi, good evening, Sonal, and thank you for inviting me. And good evening, everybody.
Totally my privilege. Welcome to the Blue Mug Chat. So let me quickly introduce you to all of the viewers here, and then we can go ahead with the questions. Dr. Ashutosh Shukla has 27 years of post-MD medicine work experience at top tertiary care hospitals in the NCR. Currently, he is the director and head of Department of Medicine at Artemis Hospital. He is also the program director of the postgraduate DNB teaching program. Dr. Shukla is the co-founder and medical director of Prana Center for Integrative Medicine, where he runs an integrative medicine practice to address lifestyle-related non-communicable diseases. Prior to this, he was working as a senior consultant and was a founder team member at Max Healthcare Saket, New Delhi, where he launched the Pathbreaking Preventive Healthcare Program and received the Chairman's Award for Outstanding Performance at Max Healthcare. A fellow of the American College of Physicians, Dr. Shukla did his MBBS and MD medicine from Delhi University, Maulana Azad Medical College. He has trained at Stanford Medical School and San Francisco General Hospital for advanced training in infectious diseases. A Harvard Medical School alumni, Dr. Shukla holds a postgraduate degree in hospital management. So privileged to have you, Dr. Ashutosh.
Thank you, Sonal. Thank you for inviting me.
Getting down to the questions. So we have two vaccines that are administered in India, Covaxin and Covishield. So what would you say in terms of their efficacy and safety?
Well, both are equally good. The government has designated various hospitals with different type of vaccines. In the sense, a particular hospital X is supplied with Covishield, another hospital is supplied with a Covaxin. So the choice is up to the consumer as to which vaccine he wants to go for, and both are equally effective and very good vaccines.
Okay. There are a few concerns regarding the vaccines actually. So for Covishield, for Covaxin, there's lack of adequate data and the Brazil regulatory authorities, they also raise concerns on the manufacturing plant. And in terms of Covishield, there's risk of clotting as documented in Germany and UK, and also the fact that it's a modified viral vaccine which delivers to the D. So there are also and to the cell. So there's also concern around it's going to alter the genome. So could you shed some light on those aspects of the vaccine?
So, as far as the Covaxin is concerned, the phase 3 trial data was released a little later in time, and that's why they probably lost out on the trust which they couldn't gather in the initial momentum. Uh, but otherwise, it's an indigenously manufactured vaccine. It's the traditional system of vaccine, in the sense the heat-killed vaccine which generates the immune system. So, I mean, it's a very good vaccine, and compared to that, the Covishield vaccine, yes, that's also a very good vaccine. Only thing is, in Europe, they did come across certain cases where there was some clotting disturbances in the cavernous sinus brain veins, uh, which were reported after Covishield. Um, and that led to certain countries banning the use of Covishield. But the European Society for Medicine, just like FDA in US, that agency did not ban Covishield. It is being still being used by a large number of consumers. And I myself, I have taken Covishield vaccine, both the shots, and I'm here in front of you. In India, especially, I think we have not come across these clotting cases being reported.
And are these clotting specific to people having comorbidities?
Uh, there's no such correlation, but yes, if you want to be little extra careful before taking the Covishield vaccine, maybe you can get a blood test done wherein you can check your coagulation system. Uh, Three simple tests in the blood: platelet count, your fibrinogen levels, and PT-INR levels. So these are tests which D-dimer levels. These are the tests which tell you whether you have a tendency towards hypercoagulability. In the sense, are you a candidate who will develop clots? If your blood tests are fine, go ahead, and I mean, this is just in case you want to be extra careful. It's not a
It's not a mandatory requirement.
yeah.
But if somebody wants these blood tests, should it be done before taking the vaccine or after taking the vaccine?
Before Just before taking the vaccine, if you want to be a little extra careful in view of these reports, then maybe you can get a fibrinogen and a d-dimer and platelet levels. That's it.
Okay, so this is actually before you get the vaccine.
Yeah.
And is there a duration with like what is once you get the vaccine, and if something has to show up in the system in your body physiologically, how long does that take for the vaccination to react to that? Like how long do we need to monitor ourselves? Say, okay, you know what? I think it's all good.
What normally happens is, uh, after 12 hours, most people are getting a little bit of fever, uh,
Yeah.
9900 or like that, and a little bit of pain at the site of the jab and body aches, which and all this lasts for about a day or two, not beyond that. And that's it. And after that, you can take a tablet, paracetamol, to relieve the pain and all. But beyond that, I don't think you need to be so careful about monitoring small little details. I think it you should treat it just like any other vaccination.
Yeah. And what regarding the second dose, again, there's a lot of confusion. So let's separate the two. So what is the recommended next dose for Covaxin and Covishield? Like how many weeks do we need to wait before we can take Covaxin and then Covishield?
So for Covaxin, the second shot should be 4 weeks later, and for Covishield, it should be 6 to 8 weeks.
Okay, Covaxin 4 weeks, Covishield 6 to 8 weeks. And why do we have to wait for this long? What is the science behind that?
So what happens is that these particles, they generate certain spike proteins on the cells, which are similar to the coronavirus spike protein, and this kind of stimulates the immune system in our body to synthesize antibodies. And then next time around, when you are exposed to a patient with COVID, your immune system will be able to fight the coronavirus and you will not get the infection. So, that much time you have to wait for a full blown immune system to be developed. So, a full protection in Covishield happens 10 days after taking the second shot.
Acha. Okay.
Yeah. And similarly for Covaxin, 2 weeks after taking the second shot, that's when you are fully protected.
Okay. Okay.
And that's the reason why everybody is saying that COVID appropriate behavior should continue in even though you have taken the vaccine shot, because you've taken the vaccine shot, but still your immune system has not developed the antibodies, so you may get the COVID infection even before the full response sets in.
Okay. Okay. So, and that's why we need to be exactly how we were before taking the shot. We need to be equally
Yeah.
responsible as. Okay. Okay. So, is there a percentage of prevention, like after taking the first shot? How preventive is COVID after the first shot? Second shot after, as you said, fully preventive, but is there some level of prevention that also occurs right after
Yes.
the first shot?
Yes, there is a certain amount of protection in the sense, if at all you get COVID disease after the first shot, the intensity of the disease will be milder
Okay.
and chances of going into complications will be lesser.
Okay. Okay. And how many days post taking the first shot does the prevention start?
So there's no such cutoff limit, but
Okay.
uh, I mean, we have had cases where after taking the first shot, people do get COVID infection, because they were lax as far as the protection was concerned. So uh, there's no such cutoff limit as such.
Okay. Now, also, Dr. Ashutosh, is it worth the wait to actually wait for Sputnik or J&J or Novavax to come to India and then get the shot?
No, I don't think there's any wisdom in that. I think whatever vaccine is available, we should just go ahead with it. See, Pfizer claims 95% protection. Covishield claims 80% protection. Well, see, these values are statistical figures which have been drawn after some studies. But still, even if you go for 80% protection, you are getting a fair amount of protection from COVID. COVID is a deadly disease. Uh, I mean, immediate protection is important because we are in the midst of a pandemic, and the number of cases, the virus which is propagating now is very virulent, in the sense it is spreading from one to another at a very fast speed. So we have to counter that, and I think mass rapid quick immunization program is essential for our country at this stage, and we have to encourage people to get as quickly vaccinated as possible, because see, it's a safe vaccine for that matter. It gives you some degree of protection. Even 80% protection is fairly good protection, in the sense, uh, there are some doctors who got COVID infection even after 2 doses of Covishield, but one or two doctors only, and but their disease intensity was very mild, and they didn't have any complications. So it does protect you from severe disease. It does protect you from complications of the deadly COVID infection. So, we've worked on COVID patients for more than a year now, and we've realized that it's a horrible disease. So, whatever best protection and whatever quick and fast protection you can get, you should go for it. There's no wisdom in waiting for Pfizer to come in or Moderna to come in.
Okay. And if somebody had an option to actually going to the US and getting Pfizer and Moderna, would you recommend that or so
Yes, if you are flying out right now, and maybe you're getting a Pfizer vaccine, and then 3 weeks later, the same Pfizer vaccine. Well, yes, why not go for it? I think you should go for it because, yes, comparatively, it is the company claims 95% protection. So it's better than the 80% protection of Covishield. So why not? But if
Okay.
if your plans of travel to US are say 3 4 months down the line, you should go for Covishield and get yourself protected right away.
Yeah. Yeah. So I think time is of immense value right now because
Exactly.
the sooner
Yeah.
we get everybody vaccinated, the sooner we can actually see the cases going
Yeah.
down. What are the reason of suddenly spike up of these cases? Is it just that we became irresponsible, or is there a new mutant, or is there a new variant? Like what's happening right now?
So there are two, three reasons for this. One reason is yes, this particular virus is just like the influenza virus. It changes its character very fast. So this particular strain, which is now prevailing, is a very virulent strain in the sense it is spreading quickly from one to another, and it is impacting the younger age group more. And it's also, uh, but compared to the first wave, the disease is milder this time.
Okay.
And why it is happening now is that's the way pandemics behave. If you trace the history, 100 years ago, when the flu pandemic happened, then also the disease came in a big wave, then subsided, then second wave came, and then subsided, then slowly went away. So that's the way these diseases behave. So, so I mean, I'm not surprised with the second wave.
I see. Okay. So we were sort of expecting this wave. Um, so, so there was an expectation of the second. You said the intensity is low, so I think we should be good. And plus the are happening. Do we know how long the immunity would last after the time the vaccination? How long is it going to be effective for?
So we do not know for sure. Even the companies which are manufacturing these vaccines, they have not put any figure to that, but roughly 1 year. That's what the estimate is. So
Okay.
after 1 year, we will have to get another shot. By then, we'll have better quality vaccines because by then the virus would have changed its character, and uh, antigenic shift and drift happens on the surface of the virus, which changes the virus. So we'll need a different type of a vaccine next year.
Oh, is that so?
Yeah. So these same companies will probably come up with 2022 variant of the vaccine.
Okay. Okay. Does that happen every vaccination though? Do they actually have the same life cycle?
No, for the flu vaccine, that's the case. When you go
Okay.
for the flu vaccine, you must make sure that the vaccine which they are giving you is of that particular year. So it's written on the vial,
I see.
but
I
not
see.
not with but not this does not happen with pneumonia. Does not happen with other diseases.
Okay. I see. And is there any? Please go ahead. You were saying something.
That's yeah, because because of the nature of this virus, because it changes its structure. So that's why you have to come up with a new vaccine next year.
So the current vaccine actually protects us from all the variants currently prevailing. Is that
Yes,
a safe?
absolutely. It protects us from all the variants which are prevailing.
Okay, okay. And is there any value to getting antibodies test done once you are done with vaccination?
Well, it's more of an academic exercise. After 2 or 3 weeks of the second shot, you can get a blood test to check your antibody levels just to know how much protection you have. And interestingly, what we've seen is that those people who had COVID disease, and then after that, once they took the COVID vaccine, their antibodies were very high, 400s or something like that. People who didn't have COVID and just took a COVID vaccine, there the antibodies were 125, 150 like that. So I think that's the pattern we have observed recently.
Okay. And what is the bodies where you can, comfortably say that you got to know? What is the
So
level of
your voice was
antibody?
breaking.
Yeah, I think there's a
Your
bit
voice
of an
was
echo.
breaking. Yeah, sorry.
What
You
I
said.
was asking, yeah, what I was asking is that what is the level of antibodies that one should have to feel comfortable about having that safety net?
So different pathology labs have different antibody titers, and they mention in brackets above 50, mostly 15, 20 nanomoles per ml. But good titers are above 50, 100, 150. That's a good protection.
Okay, so
But
that's the number.
but yeah, but even if you have good antibody numbers, don't give up wearing face masks. Don't because we are getting cases of COVID in spite of the vaccination.
Right. And there's also a lot of uh, concerns surrounding the clotting. So there is a viral video going around that doctors are actually asking you to take the blood test done after you've gotten the vaccination done. To Is there any truth to it? Is there this is post getting the vaccine?
So sorry, I missed the first part of the question.
So there were doctors. I've actually seen the video of two doctors on WhatsApp saying that there is a value in getting the blood test done after you have gotten the vaccination done. Uh, is that required really?
No, it's not required really. Blood test for what? I mean, for
For
antibody
for
titer.
for for antibody, no, actually for the clot. But you said you can get the blood test before the
That,
vaccination gets.
that yeah, that blood test is just to see whether you have a chance of having a clotting complication after the vaccine. That's all.
And if you do find out that there is, you're prone to clotting, then one supposed to do.
Then instead of Covishield, you go for Covaxin.
Okay. Somebody's actually. Viralji, my voice is not clear. I don't know. Yeah, I don't know what's happening actually. I was unable to figure that. We're not able to figure it out. It's not on. I don't know.
Um, okay, so
Anyway, so moving on. Is there any way you could have a earphone, Dr. Ashutosh? I know it's
uh,
almost towards the
um,
end.
what I can do is I can put myself on mute when you are asking me a question. That may be the.
Yeah, let's try that. Maybe that'll help. Actually, let me see if there are any questions. If you guys have any questions, please do let me know because I have pretty much asked most of the questions that I needed to ask. Dr. Ashutosh, would you actually that's really helping. So that means the echo is actually coming from your laptop because I don't hear any echo now. Anyway, it doesn't matter. Dr. Ashutosh, is there anything that you would like to tell the audience? Because I think I have pretty much covered whatever I needed to ask.
Okay, so see, right now we are in the midst of a dual burden. One is the high infection rate, with COVID infection rate. The other is the rising numbers of non-communicable diseases like diabetes, depression, anxiety, and a lot of fear around this COVID pandemic. Uh, so we are going through unprecedented and difficult times, and I think this is time for action. When times get tough, you get tougher to handle the situation. So I would urge everybody to take uh, COVID appropriate behavior, take full precautions, plus also follow a healthy lifestyle by using these 5 smart tips. Eat mindfully, exercise regularly, get adequate sound, uninterrupted sleep, keep your stress levels low, and avoid smoking and alcohol as far as possible, and stay happy and healthy.
That's a motto of happy life anyway. I actually, on that note, I have one more question. If you could just mute yourself, I'm going to quickly ask the question.
Yeah.
Thank you. You talked about exercising. Is there a time frame that you shouldn't exercise after you've gotten your vaccination shot? Rigorous exercise.
Yeah, so if the first 2 days after the vaccine, one should avoid vigorous exercise. Reason being, you know, you are likely to have a immune burst or a response, and you may have fever, etc. Um, so that's one possibility. And in this context, there are four precautions which I want to share with everybody before going in for your vaccine. Stay well hydrated on the day of your vaccine. Don't take the vaccine on an empty stomach. Have your meal and then go for the vaccination shot. Number three, if you are having any fever or any active infection, don't take the vaccine. Let it settle down and then take the vaccine. Number three, uh, um, if you have allergies or something, then be a little extra careful. The Covishield and the Covaxin for ladies in the family way, lactating mothers, there one has to be extra careful. In fact, the government of India does not recommend there.
Okay.
Then avoid anything which will suppress your or interfere with your immune system. Like people take a combiflam or a flexon or a voveron immediately after taking the vaccine. I say no. Reason being, it's a non-steroidal anti-inflammatory drug which somehow is going to interfere with your immune system. So better stick to simple paracetamol or crocin. And also avoid having alcohol, because alcohol also interferes with your immune system. So after taking the jab for a couple of days or weeks, so just avoid alcohol or smoking, which will interfere with your immune system. Otherwise, it's a very safe vaccine. I mean, we've been taking vaccines earlier as well. I mean, somehow in India, that concept of adult vaccination is not so prevalent. That's why there's so much of fear and uncertainty about the vaccination drive. But in Western countries, the flu vaccine, the pneumococcal vaccine is given on a regular annual basis, especially in people who have comorbidities. So uh, I mean, there's no point in going in so much of details. Just go for the shot, take the precautions which I've said, and you are going to be fine. And do it in a hospital setting, better not in a community setting where it's not going to be monitored so carefully. So I think we should encourage everybody to get the vaccine.
I have a question here. Does vaccine alter any genes?
No, absolutely no. None of the vaccines alter any of the genes. Uh, it's only in some vaccines that the mRNA particle, which is encapsulated in a small little bubble, enters the cell and it generates a spike protein on the surface of the cell, which is like a spike protein of the COVID vaccine. And this triggers the immune system to generate antibodies. That's it. It doesn't alter our genes, it doesn't alter our chromosomes at all.
Okay. And just in terms of technology, what is the difference between Covishield and Covaxin? One is an active and an inactive virus, but
Yeah.
in just to explain that more, if you could just tell
Yeah.
the viewers.
So the Covaxin is like the traditional vaccine where it's a heat, like just like the heat killed vaccine, and that is injected. It's inactivated, and it generates the immune system. The Covishield is a particle which is inserted into the adenovirus of the chimpanzee vaccine. Chimpanzee virus, adenovirus, and then that is injected into the human body, which makes generates those spike proteins on the cells, which generates the antibodies.
Okay, so it's just that there's a different way to approach it. But they're both safe.
Yeah, both are equally safe. You can go for either of these vaccines.
Okay, okay. I think with that, I think we have covered pretty much everything. Okay, I have something else. Namaste, Dr. Ashutosh. Thanks for your guidance. Many people are getting something called asymptomatic COVID. Can you please share something on this related to the vaccine load? Sure, Richa.
Yeah. So, Richa, a lot of people are having asymptomatic carrier state. Uh, they don't have any symptoms of COVID. They don't have fever, body ache, or anything, but they are harboring the virus in the nostrils, in the mouth, in the throat. And whenever they are speaking or talking, the virus is being thrown out into the environment. And these kind of people can be either simply asymptomatic carriers who just go on like this, or they can be pre-symptomatic, in the sense just before developing a disease they are without any symptoms. And that's why this disease is so dangerous. You don't realize who's actually spreading the virus in the community. So we need to. I mean, if a person is identified and is a asymptomatic carrier and his RT-PCR is positive, he should be quarantined for 10, 14 days, and then once his throat swab is negative, then he can move around in the community.
Richa, I hope that answers your question. Anyone? You could just mute your. Sorry. If there are any more questions, this would be the time to ask, because then I'm going to quickly wrap up the show because, okay, Richa said thank you. I don't see any more questions. So thank you so much, Dr. Ashutosh, for being with us. This was just the need of the hour, because there's so much confusion, concern, the vaccines, which so it was good that you came and you addressed all of that at the right time, because a lot of people are in the middle of getting the first ones or the second ones. When in your opinion, before I quickly wrap up, would we be done with the vaccination drive with the rate that we are?
I think right now the rate and the progress of the vaccine is very slow. It should be much faster and quicker. Probably because people are not coming ahead and getting themselves vaccinated. Uh, I mean, there's a lot of resistance. There's a lot of uncertainty. I think all these doubts need to be cleared up so that more and more number of people can get the vaccine. So I mean, the efforts need to be at all levels.
So actually, one thing that I have heard, especially in the third tier cities, is that there's a lot of inhibition and there's a lot of stigma going around against vaccination. So if you could just tell those people that it is absolutely completely safe, coming from Dr. Ashutosh, maybe they will have a change of heart.
Yeah. So I mean, we have seen the responses. It's a great thing to get vaccinated because it protects you from a serious illness, and side effects are minimal, in the sense little bit of pain in the arm, little bit of fever, but that's okay compared to the huge enormous problem that you're tackling. So I think one should go ahead with the vaccine.
Okay. On that note, thank you again, Ashutosh, for being with us. Thank you, viewers, for all your questions. Hopefully, we were able to address most of them. And so, on the Blue Mug Chat, this is just. Oh, thanks again. Bye.
Thank you, Sonal. Thank you, everybody, for joining. Thank you. Bye bye.